Hello, my name is Aubrey Lloyd, and I chose to do my final project on Turner syndrome. So, what is Turner syndrome? It is a genetic condition affecting females only. It's important to know that this condition is not inherited, it happens randomly and is just a random mutation that occurs in utero. It occurs when one of the two X chromosomes is missing or partially missing. And depending on if it is completely missing or partially missing, is what physical features we may see with those with Turner syndrome. It may be more obvious with those who are completely missing it, but with those who are partially missing a chromosome, they may not have as dominant physical features. This is pretty rare. It affects approximately 1 in every 2,500 births. And unfortunately, most often, about 98% of the time, pregnancies with Turner syndrome result in a miscarriage. So, what physical features and medical conditions can we expect with someone with Turner syndrome? Some physical features include short stature, a webbed neck, a low posterior hairline, broad or shield chest, and larger hands and feet. These physical features may not be as obvious when the baby is freshly born, but they may become more obvious as they grow. Some common health conditions include a coarctation of the aorta, which often comes with a bicuspid aortic valve. I actually also have a coarctation of the aorta and a bicuspid aortic valve, so I know a little bit about this. The coarctation of the aorta occurs when the aorta is constricted in one area and therefore limits blood flow to the lower body. So, in my experience, my blood pressure in my upper extremities was extremely high, around 180s, 190s, and my legs was pretty low because of the lack of blood flow getting to my legs. And so that is something that we as nurses can look for in these patients, and why a cardiovascular assessment is going to be so essential with these patients. Unfortunately, those with Turner syndrome often also face endocrine issues, such as ovarian failure. And this can lead to a delayed or absent puberty because many of them do not produce estrogen because of the ovarian failure. They also may have hypothyroidism, and it's important to note that many of these patients also have diabetes because of the endocrine issues. Although they face many physical and medical conditions that may be challenging, their intelligence is usually normal, though it may vary from person to person. For genetic testing, prenatal testing that we can do to detect Turner syndrome is non-invasive prenatal testing. This is when we take a sample of the mother's blood and we can see kind of if the patient is at a higher risk for developing Turner syndrome. And if that comes back at a higher risk, then we can move to something more invasive called chorionic villus sampling, which is when we perform an amniocentesis. We take some of the amniotic fluid and we can see the baby's chromosomes. And this is a definitive diagnosis of Turner syndrome. If the child is born, we can do something called karyotyping, which helps us to visualize the chromosomes and get a better idea of their number, structure, and size, and therefore we can diagnose the patient at that point. FISH is another test that we can perform. It's fluorescence in situ hybridization. This is just a more detailed version of karyotyping that uses fluorescent probes, which allows us to detect even smaller structural differences. So this may be helpful with those who have maybe a partial loss of the X chromosome rather than a complete loss. For our care plan, some essential components is going to be growth hormone replacement. Typically, those with Turner syndrome have a short stature, and missing one of these X chromosomes impairs their bone growth, which is why they have a short stature. So, the growth hormone can help us with long bone production and improve their final adult height. We also will want to use estrogen therapy replacement with these patients. We usually start this around age 11 to 12 when puberty would normally start to help these women develop breasts, have uterine growth, menstruate, and estrogen is also an essential um, hormone needed for bone mineralization. So it is essential that we initiate this estrogen therapy. Cardiac monitoring and management is another important component of a care plan for someone with Turner syndrome. We will want to have regular echocardiograms, periodic cardiac MRIs and CTs, and we will want to ensure that their blood pressure is under control to avoid further complications. With the coarctation of the aorta, they may need surgery to open up the aorta and allow that blood flow to get throughout the body. We may also use calcium and vitamin D supplementation to help with calcium intake and to help with increasing their bone mineral density. This will also reduce their risk of osteoporosis. A cardiac diet may be initiated for the cardiovascular issues that they may face. And mental health support is going to be essential with these patients as they're facing many health challenges, and infertility can be very hard to go through. So they may need fertility counseling and guidance on how they can have a family if they desire to do so. Some patient resources include the Turner Syndrome Society of the United States, Turner Syndrome Foundation, and the National Organization for Rare Disorders. Each of these sources aim to further research, advocate, and improve the lives of those with Turner syndrome. Some of them also offer scholarship opportunities and support groups. For my advocacy poster, I chose to focus my audience to the general public, and the main focus of my poster was to raise awareness and request donations for those with Turner syndrome facing infertility. Because of the ovarian failure and the low chances of being able to conceive naturally, many women with Turner syndrome who want to have children may have to use alternative methods such as donor eggs, IVF, and surrogacy. As we know, these methods are extremely expensive, and so starting a family can be very difficult for them. So that is why for my poster, I chose to focus on the infertility side of Turner syndrome and how we can hopefully spread awareness and find more resources and generate donations for these women so that they can have a family if they choose to do. However, it is important to note that some women with Turner syndrome can conceive naturally. And if they do, they just may be at higher cardiovascular risk. So we will want to be aware of that as we care for these patients. These are my sources. Thank you so much for watching. Hope you have a great day.